You're watching Coping with COVID-19 with Chris Manners. Today's special guest is Dr. Stephen Zlutnick.
Hi, I'm Chris Manners, and you're watching Coping with COVID-19. Today my guest is Dr. Stephen Zlutnick. He's the director of the Behavior Therapy Center of San Francisco and a professor emeritus of counseling psychology at the University of San Francisco. Dr. Zlutnick, welcome back to the show.
Thank you. Nice to be here.
Well, it's been 6 months since we last talked, and while we know an awful lot more about how the virus works, it seems like we're back in exactly the same place. And now, pandemic fatigue seems to be affecting everybody. Could you talk a little bit about pandemic fatigue and what it is, and provide some advice for people so they know how to prepare for the long haul?
Yeah. Well, pandemic fatigue is a complex of symptoms, and any one, you'll see, most of us are experiencing at least one of these. But physical exhaustion, we just feel tired, changes in mood and more worrying, which leads to an increase in anxiety, sense of this is never going to end, hopelessness, so that can lead to mild depression. Aches and pains, headaches, back pain, decreased motivation. It's just kind of hard to get things done. A difficulty concentrate. Similarly, it just can't seem to focus on anything. And a short fuse. We're tending to get a little more irritable. So you can experience one or more of these things, and that's generally considered the pandemic fatigue. I think another level of pandemic fatigue, which we can talk about as well, is that we're letting our guard down. We're not being quite as diligent about following through on the things we're supposed to be doing.
It seems like chaos is all around us, sometimes in our personal lives, across the whole country, perhaps even in our local communities. How can we maintain balance when everything around us feels like it's in disarray?
Good question. First of all, I think we would probably need to get out of denial. When this all started in February, March, we thought it was going to be a week or two, maybe a month or two at the most. Now we're 8 months later. We're actually in a little bit worse shape than we were then. Things have not improved. So I think the first way to cope with this is we kind of have to deal at a more patient level. We need patience. This thing is not going to end quickly. Even with a vaccine, most offices downtown are not coming back until next July. I think some of the stress reduction techniques we talked about in the last video, self-control techniques like relaxation or yoga, any of those, breathing exercises. I think combining that with taking good care of ourselves, getting enough sleep, exercising, which is critical. I think it's critical for two reasons. One, it keeps you active and makes you feel better. And two, for most of us, you can get out of the house to do it. The whole notion of social connections, which we talked about before, has not changed. It's just exacerbated. Most of us have lost our connections to other people in the way it used to be. Used to hang out with friends, go out for a beer, have a lunch, go visit. Now everything's much more constrained. But I think that does not eliminate reconnecting with people. So I think the social distance visits are a good way to go. Visiting people, keeping your distance. And no, it's not exactly the same, but it's still better than no contact at all. Video visits, FaceTime, Skype, pulling out old photos if you're isolated and alone. I think online classes are another way to stimulate yourself. Online religious services to deal with some of the spiritual issues, I think is important. I think also need to remember that you can reach out to mental health workers. Most therapy is being done online now. There are community programs, there are private practitioners. I would not rule that out. And last, I think, is assertion is a skill. We need to be assertive because people are encroaching on our space a bit. And it's difficult for people. I've heard this repeatedly. I was at an outdoor social distance event, but people kept trying to come up and give me a hug, and I had trouble saying no. Saying no is not an easy one. So I think practicing, learning to say, no, please, let's keep our distance is really helpful. I think another thing we can do to cope with all this is to stay flexible. Particularly as recommendations from healthcare providers change, which they do. A lot of people have criticized this as a reason not to listen to science. Well, first they said that you didn't need a mask, and now you do need a mask, and then it could be inside and then outside. This is how science works. Science works by an accumulation of research. Each study changes things slightly. Oh, it turns out it's not just contact, it's in the air. So we do need to wear masks. I think another is finding a community of friends that reinforces taking care of oneself and being safe. I think that's important.
I hesitate to talk about the flip side of the pandemic, but aren't there some benefits to being able to spend more time with your family and possibly having the chance for a little more introspection?
Yeah, I think there have been a number of silver lining benefits, if you will. One is the family. People are spending more time together. Now, that can be problematic if you have poor family dynamics, but in general, it's been a positive time for a lot of people. I just saw a study the other day that 70% of fathers said they felt closer to their kids because they were home more. And it's not to say that mothers aren't having the same experience, but the bonding has been different, and that's a very positive thing. We've got cleaner air and cleaner water. You can see the bottom of the canals in Venice now. So from an aesthetic point of view, there have been some gains. Telehealth has exploded, both medical kinds of problems and mental health. Most therapies being done online now. I've literally not been in my office since March. Since the 1st of March. And virtual education, which again, I think is something you can do as a way of coping with everything, is we can bring a lot more learning experiences into our environment that we were not able to do before. And so that's really taken off.
Indeed. So finally, can we talk about this upcoming holiday season and how the pandemic's going to make it so much more difficult for everybody? How do we avoid feeling guilty if we decide we need to curb our celebrations because we need to limit our potential exposure to the virus?
Yeah, well, that's a big one. Look, the holidays are a hugely important time for most of us. It just brings up everything around family. So on the one hand, that motivates us more to try to connect. But we need to remember that the virus is not very forgiving. The virus doesn't care how badly you want to see your family. So when you have guilt for not doing things for Thanksgiving, I think the flip side of that is not being guilty for exposing other people in the family to unnecessary health risks. And a lot of people are justifying more social connection with family on the basis of it's a big holiday. And again, all I can say is the virus doesn't care that it's a big holiday. And then I think that raises issues of, well, how are we going to do the holidays? And I think we do that by getting more creative. People are talking about virtual meals when possible. We'll all fix a meal at the same time and eat it together online, or just some kind of a ritual together online, even if it's let's meet for an hour with the family on Thanksgiving. I think that's important. Another thing I think is, if we can't be with family, let's help people who really can't get out and are isolated, take a meal over to somebody who meets one. Do you have a friend or a neighbor or somebody who you know is alone? So yeah, it's going to be dramatically different for us this year. I don't think that means we can't have a nice holiday. It's certainly different. I'm going to miss my family reunion, but it is what it is.
Oh, and I think your earlier comment about assertiveness really makes sense in this context. If you're being pressured by a family member who says something like, "Oh, but we always get together with all the kids every holiday," and you're not comfortable with that, you need to figure out a way to be able to say no.
Yeah, and look, last thing I'd like to say about that is somebody who teaches assertion all day long, because it's a really critical skill in good coping. I can tell you it's not easy. I have difficulties sometimes. It's a simple concept, but it takes some work. Practicing assertion is helpful. Practice out loud to yourself when you're alone what you will say to people who get too close to you or try to come in for a hug. You're going to have to be able to say, "Please, I'm sorry, I'd love to do that," or whatever your own words are.
Well, thanks so much for coming back on the show, Dr. Zlutnick. I really appreciate the time you've given us today.
Happy to be here. Thanks, Chris.
Well, that's it for this episode. We'll be back with more pandemic-related information shortly. You've been watching Coping with COVID-19. For SFGovTV, I'm Chris Manners. Thanks for watching.